You've probably been hearing a lot about the new coronavirus, COVID-19. It's a member of the coronavirus family, and this strain is one that has never been identified up until 2019, December 2019. This illness or this disease has been known to cause a severe respiratory illness that could potentially lead to death. But most people who are infected with the coronavirus, they can have symptoms that are quite mild, or they can even be asymptomatic, meaning they may not even exhibit symptoms at all. The common symptoms of COVID-19, the new coronavirus, essentially are shortness of breath, fever, and cough. Those are the three mainstay symptoms that you need to be aware of with the coronavirus. However, there are a lot of other illnesses and diseases that can cause those similar kind of symptoms. So you need to put it in perspective. When you're having any of those symptoms, you have to think, have you had any kind of travel history that has put you at risk for potentially having or obtaining the coronavirus? Have you been around somebody else who's been infected or has been around somebody else with coronavirus? So no need to really panic or be alarmed if you have a cough. You need to look at the full picture in totality and to see if there are any risk factors that put you at risk of having the coronavirus to begin with. The virus is essentially caused by respiratory droplets. So what does that mean? When you cough and sneeze, there are various particles that come out of the mouth, that come out of the nose. Those droplets are what become infectious with the coronavirus if somebody does have the coronavirus. So when you come in contact with somebody that's coughing or sneezing and you touch any of those droplets or breathe in any of those droplets, once you have that contact with the infectious droplet, that is what can potentially infect you with the coronavirus. So the issue with touching your face frequently, when we do that, you don't really know what you're touching at all times. When you're touching surfaces, when you're out in public transportation, when you're out with your friends, when you're out with your family, if anyone is infectious and sneezing, if you are touching any of those surfaces that are actually infected with any kind of infectious respiratory droplet, when you touch your face, there are various areas of the face that if you touch the mouth or the nose or the eyes, you can potentially infect yourself with some of those virulent particles. And those can be areas in which you can actually infect yourself easily with virus. Prevention at this point is what is really key. So the first thing that you need to do is adhere to strong hand hygiene practices. What does that mean? Wash your hands frequently. Make sure if you've been around people that are sick that you're continuously washing your hands, using a hand sanitizer that's alcohol-based, at least 60% alcohol-based hand sanitizer. That's essential. You should just try to avoid those that you know of that are really sick, and if you yourself are sick, do not expose your illness to the population. So stay at home. Don't go to school if you're not feeling well, if you're having the fever, cough, shortness of breath. Alert the medical authorities and let them know what's going on with your health, but don't expose everyone to some of these symptoms. Not everyone should be wearing masks. The masks should really be reserved for those who are actually infectious. So if you are symptomatic, meaning that you're showing a lot of the symptoms of cough, sneezing, and all of that, you should have the masks on so that you can prevent it from spreading to others. But if you are perfectly healthy, there's really no indication to wear those masks. And just in general, not everyone knows how to properly wear those surgical masks to begin with. So it should be reserved for those who are actually sick, and even the caregivers, the hospital personnel or the medical personnel that are taking care of these sick contacts.